have been asking me that is the growing cases of COVID in children a cause of worry? But before that, we need to understand why is there a sudden increase in the cases of COVID amongst the children population. There are three main attributable reasons for this. Reason number one is that the children population or the population between the age group of 0 and 18 is not being vaccinated against the COVID-19 vaccine, and especially so the very younger age group. Now, during the times of COVID and the lockdown, this was the population that was not supposed to move out of their houses. They did not go and attend school. They did not move out of their houses. They were protected by their parents, and hence their exposure to the actual COVID infection was also minimal. And hence, this is the population that is most susceptible right now. Reason number two is that in April, the restrictions have been waived off, and hence people are moving without the masks and without social distancing, and hence during this time when the exposure level is at the peak, the susceptibility of the population which is not protected against this infection through vaccination is highest. Means the children population which is not being protected by the vaccine are most susceptible. Reason number three is that the opening of physical schools once again. So hence the opening or the reopening of the physical schools has attributed to the increase of exposure to COVID infection or the coronavirus for the children age group. And hence, due to these three reasons, we see a sudden spurt or increase in the COVID cases in the children. But is this a cause of worry? My answer to this is no. The reason is that the symptoms of COVID-19 in children are very mild, and there is strong evidence of past 2 years to support our theory behind this, that the infection or the symptoms of COVID-19 in children are very mild, and hence there is no need to worry. Then there is another reason, that if the hospital cases are not rising due to this increase in the COVID infection rate or the rate of increase in COVID in children, if the hospitalization is not increasing subsequently, hence there is absolutely no reason to press the panic button. But as parents, you really want to know what you need to do once you see or you identify your child having a coronavirus infection. Obviously, to prevent him or her from the coronavirus infection, you need to follow the social distancing and other norms which are set aside by the government. But yes, once the child is infected with the coronavirus, what is that you need to take care of? Firstly, you need to monitor the temperature, the fever of the baby or the child on a regular, at least 6 hourly basis. You need to monitor the blood oxygen saturation, and you need to look for signs of distress. When I say signs of distress, this means the breathing difficulty, moving of the chest, like abdominal muscles contracting. You can feel the strenuous breathing that the child is making. You need to look for these signs. Obviously, your pediatrician may advise you to go ahead with a few antipyretics, paracetamols, anti-allergics, or vitamin C tablets. You must adhere to your pediatrician's advice, your doctor's advice for your child or your baby. Then the next thing is when to report to a hospital or an emergency. If the symptoms are not subsiding by 7 to 8 days or are not reducing, if the fever is very high grade above 102 degree Fahrenheit, or if you see signs of respiratory distress, breathing difficulty, or blood oxygen saturation dropping below 95 for a child or a baby, you must report to an emergency in a hospital or refer to a pediatrician immediately without any further delay. Now, people are also asking me whether we should go ahead with vaccination or whether the government should initiate the vaccination for children and the baby age group also. My answer to this question is no. The reason is that there is a strong evidence to support that a COVID vaccination does not prevent the infection. It makes the infection more mild. This was the case that we saw in Omicron. So vaccination would not prevent an infection but make the symptoms mild. And as it is in the children age group, we do have mild symptoms, and hence a vaccination may not offer something that as a resolution for this outbreak, and hence vaccination may not be mandatory or may not be necessary for the children age group or the child or your baby. So that's all from my side in answering all your questions with reference to COVID in children. If you have any further questions, please write down in the comment box and I will make an attempt to answer them to the best of your satisfaction. If you like this video, please do like, share and subscribe, and don't forget to watch my next video. Thank you.